A client with tuberculosis is receiving ethambutol-meambutal, all of which are laboratories to be examined except a complete blood count, B liver function test, C triglyceride level, D uric acid level. Triglyceride level is not monitored during the treatment. Option A, this is to monitor for thrombocytopenia. Option B, this is to check for hepatotoxicity. Option D, this is to monitor for hyperuricemia. A nurse is giving instructions to a client receiving pyrazinamide. Which of the following is not true regarding this medication? Correct answer, C. It enhances the effect of allopurinol. Patients taking pyrazinamide decrease the effects of allopurinol, colchicine, probenecid, and sulfenpyrazone. A client is taking streptomycin. The nurse explains the nervous system side effects of this medication. The nurse correctly states that this medication causes damage in which cranial nerve? Correct answer, B. Cranial nerve 8. Nervous system side effects of streptomycin include 8th cranial nerve toxicity, which typically affects the vestibular system, clumsiness, dizziness, and stativeness, but may also affect the auditory component, ringing in the ear, loss of hearing, all of which are examples of antiviral influenza medications except. Correct answer, B. Ethionamide tricator. Ethionamide tricator is an antibiotic used in the treatment of tuberculosis. Rifabutin-myclobutin is prescribed to a client with active Mycobacterium avium complex disease and tuberculosis. The nurse determines that the client is experiencing side effects in which of the following except. Correct answer, A. Tingling and numbness of the fingers. Tingling and numbness of the fingers. Peripheral neuropathy is associated with the use of isoniazid due to the ability of the medication to damage nerves. Nurse is giving instructions to her client who is taking antihistamine. Which of the following nurse teachings is appropriate for the client? Correct answer, I. Avoid ingesting alcohol. Because alcohol and antihistamines have sedating properties, concurrent administration of these drugs should be avoided. Antihistamines are a pharmaceutical class of drugs that act to treat histamine-mediated conditions. Patient has vertigo. Which antihistamine is best for his condition? Correct answer, B. Meclizine. Meclizine antivert is given for vertigo and motion sickness. Meclizine, an FDA-approved drug, is a first-generation antihistamine used for the symptomatic management of motion sickness. These symptoms include dizziness, nausea, and vomiting. It also treats vertigo symptoms caused by vestibular diseases that commonly affect the inner ear, such as Meniere's disease. A 20-year-old student used to buy OTC drugs whenever he felt sick. Which of the following statements best describes the danger of self-medication with over-the-counter drugs? Correct answer, C. Clients minimize the effects of over-the-counter drugs because they are available without a prescription. The body processes every medicine differently. When medicines are used together, the ways they affect the body can change. Patient will be having her exam in pharmacology tomorrow. She should be aware that antitussive is indicated to. Correct answer, D. Relieve a dry cough. An antitussive is a cough suppressant. Antitussives constitute a heterogeneous class of compounds that inhibit cough through either a central or a peripheral mechanism, or a mixture of the two. Antitussives are cough suppressants. There are two ways to inhibit coughing, centrally and peripherally. The nurse should instruct a client who is taking an expectorant to. Correct answer, B. Increase fluids. Increasing fluids will help liquefy secretions and facilitate removal. Drink plenty of fluids while taking this medication. Fluids will help to break up mucus and clear congestion. An expectorant is a type of cough medicine that thins and loosens mucus. These medications are typically used for managing the effects of chest congestion, especially when symptoms are caused by persistent mucus. When administering the methylxanthine theophylline, the nurse can expect. Correct answer, B. Increased pulmonary function. Theophylline will improve ventilation, so there will be an overall improvement of pulmonary measurements. Theophylline is a drug derived from methylxanthine and has smooth muscle relaxant, bronchial dilation, diuretic, cardiac and central nervous system stimulant activities. A client with which of the following conditions may experience a dangerous or fatal side effect of theophylline? Correct answer, a cardiac disorder. A client with a heart condition may experience dangerous stimulation from this drug. Use cautiously in patients who have cardiac arrhythmias, as it may exacerbate arrhythmias. Theophylline should be administered cautiously with all the other choices, but the consequences are most dangerous or possibly fatal for clients with heart conditions. To evaluate the effectiveness of theophylline therapy, which of the following laboratory values must be drawn? Correct answer, theophylline levels. Theophylline levels must be drawn to determine if the drug is present in therapeutic amounts in the client's serum. Theophylline has a very narrow therapeutic window, and its interaction with various other drugs has led to the limitation of its use. The effects of theophylline may be increased by, correct answer, cimetidine. Cimetidine will increase the effects of theophylline. Other medications can affect the removal of theophylline from the body, which may affect how theophylline works. Examples include cimetidine, disulfiram, fluvoxamine, interferon, mexaltine, propranolol, rifampin, drugs used to treat seizures such as carbamazepine, phenytoin. Phenylephrine hydrochloride neosynephrine is prescribed for a client with nasal congestion. The nurse who is providing teachings about the medication should include which of the following? Select all that apply. Correct answer, A, B, and C. Option A. Taking large amounts of caffeine can increase restlessness, palpitations, nervousness, or other side effects of phenylephrine. Option B. The medication stimulates alpha-1 receptors, causing an increase in blood pressure. Option C. The medication can trigger asthma, so it is important to notify the healthcare provider if a client has a history of asthma.